Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of my Health Talk podcast today is what is coronary artery disease and what are the symptoms that somebody experience before they go to the emergency room, before the help should be sought for. So the major symptoms, what happens when we get sick and we don't feel good, then we ask ourselves, what are my symptoms? What is happening with me? The major symptoms of coronary arterial disease include shortness of breath, chest pain, fatigue, palpitation, and occasionally swelling in the fit area. So those are the symptoms that we should be considering in our mind if we are not feeling good while you are at work or while you are doing a desk work, you just don't feel good. So thinking all this in your back of your mind, one should act accordingly. The main causes, so these are the symptoms: fatigue, palpitation, swelling feet. The main causes, what causes this is narrowing of the coronary arteries due to the clogging and a plaque formation. So as soon as we know that the symptoms are usually, the best thing is for anybody is to seek for help. How do I seek for help? Call 911 or have your relatives, your staff, or whoever you are with is to take you to the emergency room. So when you go to the emergency room doctors are there. Initially, even when you are at the ambulance, the paramedics, they are very much experienced and equipped. They will first of all take your vitals. They will check everything. A quick EKG is performed. IV fluids can be started at the ambulance if it is needed. After the patient is, after you are stabilized, then there are telemetry connected with the hospitals, and the hospital emergency room is notified because they are ready for the arrival of the patient. When you go to the emergency room, the same thing is being done. Check the vitals, start IV fluid, put them on oxygen if needed, and most important thing is something to relieve the pain. To relieve the pain, usually morphine is given, very small dose, or nitroglycerin if the blood pressure is stable. There are invasive and the non-invasive tests that are done when patients go to the ER. The non-inclusive ones, EKG, stress test if patient is stable, because stress test will evaluate the heart functions and the coronary blood flow to exercise. And third is the imaging test, echocardiogram. The echocardiogram done creates an ultrasound waves to determine how the blood flow through the different structures of the heart. Coronary angiography, this is a very significant test that is a highly diagnostic procedure, and that is done only if there is an evidence of occlusion of the artery or its branches. Now, there has been researches, recent modalities in the imaging procedure and the drugs treatment. So now, I like to say a few words about what is the role of calcium scoring in predicting the coronary ischemia and the heart attack. There has been going through the literatures, which I will mention at the end of my talk in the bibliography. Is there are several research studies done, and they have arrived to the fact that when calcium is present around the arteries, a determination of calcium score detects the severity of the heart attack. That is, a calcium score of 100 to 300 means there are more plaques deposit in the coronary artery, and that signifies a major to severe heart attacks. So what are these? I mentioned about the plaques that deposit at the coronary arteries. What are these plaques? These plaques are built up of calcium, a low-density lipoprotein, and triglyceride. So the treatment, the treatment for calcified lesions in the coronary arteries are very important, and time is a big factor in patient survival in heart attack. So cardiac computer CT for calcium scoring, how do they do it? This is a non-invasive procedure that is done at the stable patient in the doctor's office. What is it? The cardiac computer CTC for calcium scoring that uses special X-ray equipment to produce a picture of the coronary artery to detect the size of the plaques. This is an outpatient procedure that takes only 30 to 40 minutes while the patient is in the X-ray lab. During the test CT scanner, they take pictures of the heart and the coronary arteries in slices to determine where is the plaques located. So after the procedure is done, then there is a method to calculate the score. So a score of 1 to 99 in the calcium scoring test means a simple conservative treatment, and the patient should be started on the statin therapy. The calcium scoring in older individuals above 100 suggests the test to detect the severity of the coronary artery narrowing or blockage at the intersections of the artery. Since calcium is a marker of CAD, the amount of calcium detected plays a significant prognostic tool in order to decide the treatment. So what are the major risk factors for coronary artery disease? For a general population, what are the risk factors? The risk factors include high blood pressure, high cholesterol, diabetes, obesity, a family history of heart attacks, smoking, obesity, and physical inactivities. So those are the major significant factors. Now, so far as the treatment is concerned, for the mild to moderate calcium scoring system, the patients are usually followed by the family practitioner, by their cardiologist, who repeat those tests very often. Proper medications is very important. So there are preventive strategies. So there are several other markers which are used to help stratify the risk of the heart attack and further coronary artery inclusions. So then to make it to put a brief summary of what I have been talking about, the coronary heart disease, artery occlusion, is that one should stay healthy. So what are the precautions you are taking at all the ages? Stay active, eat a well-balanced diet full of vitamin, nutrient. Recently, vitamin D has been added to the regular medications like multivitamins and and also the cholesterol-reducing medicines, the statin. I don't want to go into the details about this because this will follow in my next slide presentation, where I will describe about the structure of the heart, the coronary arteries occlusion, and also what are the guidelines for the safety. Bottom line is stay healthy, eat a well-balanced diet, stay active. Exercises play an important, significant role in your health. Exercise, meditation, and always think positive. It's very important for us in life is to forget what happened in the past, but just take care of the present situation and act accordingly. For the senior citizens, people in the nursing home, it is advisable to continuously check about the medications that they are taking, and if there is any change in the medication, they should be taking it, and also reduce the pills that you have been taking unnecessary. Nurse practitioner, the home visitors staff, and they will always have a record of the medications that you are taking with before you go to the senior citizen home or the nursing home. And it's very important to be a regular with your medication. So this is the end of my first segment of the podcast about coronary artery disease, and during my next segment, I will share with my viewers some slide presentation as well as the anatomy of the heart and the anatomy of the blood vessels supplying the heart. I'd like to thank our viewers for watching me today on my podcast about the coronary artery disease. I'd like to thank our producer for letting me produce this podcast. And until I see you again, have a wonderful, safe fall and winter. Thank you again.